Hi everyone. This is just a short presentation on week one as you start community wellness. And I want to point to some of the important concepts that I want you to pay attention to as you complete readings and also view the other resources that are on the Concordia website. So, first of all, just an overview or a description of what community health nursing entails. And again, this is a move from hospital based or agency based nursing care and looking at working out in the community in a variety of different settings. And we usually break this into three different groups. And as you think about these groups, also consider your community agency and what it entails and how you would place yourself then as you do your practicum observation hours. So the first section is what we call community-based nursing, and this is where the nurse is working with individual patients, usually that are ill. I'll give you some examples: patients on dialysis, patients on hospice. Well, not hospice care, but patients that are being treated for cancer. So they're coming into a facility. They're still living in the community. Hopefully, they have the support of their family. So they're in that setting of the patient and family members. But they come and go as treatment is needed. Then we move into what's called community oriented nursing, and these would be agencies, again, um, who are doing specific programs following a community assessment, which we're going to talk about next week. And they are servicing, again, individuals, family members, family groups, and then looking at community needs. So often these kinds of programs, as I said, follow from information that's been gathered. They have decided on specific health related programming that would benefit the community and keep them healthy. And their ideology is to preserve, protect, promote, and maintain health. So a good example would be a smoking cessation program where they are working with individuals and maybe family members, depending on if they're offering support groups, and they're trying to decrease the incidence of smoking in the community so that we can make it healthier. And then the final one is our public health nursing, and this is an entity on all onto itself. It is definitely, again, that population-based um, healthcare planning, and again derives directly from community assessment in a variety of manners. I want to encourage you as you start to think about doing your community assessment to look at your local public health department's website and access many of the assessments and health-related databases that they have available to the public. This is where they get their information from, and this is how they do their program planning. And along with it, just to keep in mind, is that public health nursing typically has some kind of, well, it's politically linked. It's a governmental agency, and at our level, public health departments can either be offered through a city base or a county base. Then you have to keep in mind that there are state public health agencies that are consultant type. They have a consultant type arrangement with the locals, and then we also have governmental agencies in public health at the federal level. Kind of the interesting thing about it, there's no direct link. Some programming comes right from the feds down to the locals, some filters through the states, some are initiated by the states, and even some are initiated by county or city areas, depending on the boards that are governing that section of the citizens or population, and they may recognize a particular need and decide that they want to put some funding into it to help, again, keep our communities safe. Um, the two other aspects that are very important with public health nursing, there are three concepts that I want you to keep in mind, and these are critical pieces that have to be completed um, through public health nursing, it is a mandate. They have to provide assessment. Again, they have to go out and assess the geographic population area that they are responsible for. They have to provide assurance to the citizens in that area, and that means that they have to have nurses that are trained to analyze the data and then make decisions about what kind of programming needs to be put in place. And along with that, there's policy development. So if, in fact, policies need to be changed, then they have to work with the legislators or local governmental agencies to try to make those things happen so that they can guarantee, again, that the public is safe. And it's the prime tenet in public health nursing is the greatest good for the greatest number of citizens. So they really are trying to get out there and provide healthcare programming that will service the particular needs of, again, the citizens that they're working with. So it's just a very interesting area of nursing, and I hope as you delve into the content this week that will become apparent. There are two other areas that I want you to pay particular attention to as well. There is an audio PowerPoint that is on your site for week one, and it is a review of the history of community health nursing, and really does bring out all the things that have been accomplished in public health and community health um, really since the beginning of our country, and even back into Europe. So please watch it. It's all pictures, and I hope it gives you a flavor for the kinds of challenges that we faced and some of the great accomplishments that have occurred. And then the final one is to really look at the current healthcare system, both private, which I think a lot of you are familiar with, and also then the public or federal, state, local governmental agencies that are in place to provide healthcare services. And in particular, pay attention to the agencies that are listed under the U.S. Department of Health and Human Services. There are a wide variety of them, and I call your attention to it because we're going to cite some of those again as we move through the content of this course. Areas like the CDC, the National Institute of Health, Food and Drug Administration, if you can just have a brief understanding of the kind of services each of those provide, you're going to see that intertwined as we move through and talk about different areas in this course. So I'm going to let you guys go. I know everyone is busy, and I will be back with you next week. I'll be watching online as you complete your first discussion question, and again, those are due by Sunday night, and I will be providing feedback and just watching how you're accomplishing some of the tasks that you'll be working on this week. Please call me if you need anything. Please email me if you have questions, and I will try to help you as much as I can. And again, enjoy the content. It is truly a very unique area of nursing, and I hope you enjoy it.